Hi, in this video we're going to talk about the bony anatomy of the wrist and common injury around the area. Now bones of the wrist include the two long bones of the forearm, the radius ulna, also as well as two rows, 8 small bones at the base of the hand called carpal bones. Here you can see the radius and the ulna. Now in the proximal row we have scaphoid, lunate, triquetrum, and pisiform. The pisiform being the smallest bone is able to be palpated at the backside. The distal row we have trapezium, trapezoid, capitate, and hamate, hamate being a hook-shaped bone. Now the wrist joint, also known as the radiocarpal joint, has 4 bones which are scaphoid, lunate, radius, and triquetrum. Now in between 2 rows of carpal bones, we have the midcarpal joint. The wrist joint allows a large range of movement including flexion and extension, as well as abduction and adduction, or radial deviation and ulnar deviation. The flexibility of our wrist allows us to perform many movements, but it is also vulnerable to injury, especially fouche injury or falling on an outstretched hand. It can cause many types of fractures, and the most common type of fracture being the scaphoid fracture. So I think to properly understand scaphoid fracture, we need to introduce the concept of anatomical snuff box. So this triangular depression is located on the lateral dorsum side of the hand at the level of the carpal bones. It was used in the past for people to sniff drugs into their nose, thus the name anatomical snuff box. Now, the scaphoid bone and radial artery are important content within the structure, and some complications can include damage to the radial artery causing avascular necrosis, high rate of non-union, which is improper or delayed healing of the bone, and progression of non-union can lead to a collapsed wrist or eventually arthritis. Now, in order to accurately diagnose a fracture and to decrease patients' radial exposure, the Amsterdam wrist rule is applied to screen which patient is appropriate. So essentially those who are male, those who are older, those who have a swelling of wrist or anatomical snuff box, and most importantly, those who have a visible deformity at the wrist joint are subjected to radiography. And that is it. We hope you now have a good understanding of the bony anatomy of the wrist and scaphoid fracture. Thank you for watching.